Welcome back, students. This is the Viva on the internal structure of the urinary bladder. This was our urinary bladder. I gave the cut at the junction of the two lateral borders and at the anterior border here, and reflected the anterolateral right and left surfaces on either side so as to expose the interior of the bladder. Now the thickness of the bladder is the bladder wall is quite thick here because it is made up of the three layers. Outermost it is the fibrofatty tissue or fibroelastic tissues are there. Then the thick muscle coat is here, okay, and these muscles, they are the smooth muscle in nature. They are called as the detrusor muscle. They are known as detrusor. It is to be described as to be arranged into the three layer outer and inner longitudinal and intermediate circular. But in the microscope, the layering of the muscle is not seen. They run here and there haphazardly. So the detrusor muscles, which forms the main mass of the wall of this bladder, they are smooth in nature. Then the third layer, which is the inner layer, is that of the epithelial layer, the transitional epithelium, which rests on the lamina propria, and the lamina propria is quite loose, and because of that, the inner aspect of the urinary bladder shows that the presence of the rugae or the foldings. See these foldings, irregular foldings are seen except in the lowermost part, which faces towards the posterior surface or the base of the bladder. And here you see a triangular area where these rugae or the foldings are absent. The reason of this smoothness or absence of the folding is that there is the epithelium, that is the transitional epithelium, is directly applied here to that of the muscle coat. Okay, so this is the opening. See this in the tip of the forceps where it is going here. This is the opening of the right ureter, and just here was the opening of the left ureter was here. So between these two opening, and there is a lower down inferiorly, this opening here is the opening of the internal orifice, okay, of the urinary. See this, now I have just kept it. This is the internal. So this triangular area between the two ureteric orifice and the internal orifice are the opening. Now this triangular area, which is just corresponding to the base or the posterior surface of the urinary bladder, is called as the trigone. So this, because it is triangular in nature, and I told you the reason why it is smooth, because here the epithelium is directly resting onto the muscle coat without any loose connective tissue intervening between these two layers. So this is that the trigone of the bladder. Now, if we cut a section through this internal orifice here, this was the internal orifice passing through this urethra here, okay, which has come out through the prostate. I hope that we will see the prostatic urethra. I will try to cut it here, okay, and we'll see that whether we get the exact section passing through the urethral orifice, urethra of the prostate or not. Just a minute, okay, I am trying to cut it. See here, the section is passing through the prostate, okay, through the internal urethral orifice, okay. The section is passing through various lobes of the prostate, and then this part is the prostatic urethra, okay. In the lower part it has come. Yes, see this. This was the internal urethral orifice, if you can see here. This was the internal urethral orifice, and then this is the prostatic urethra, and then this comes here in the midline, and on the side of which there will be the opening of the ejaculatory duct, okay, and then this continues down below with that of this, okay, the urethra. See this, that the will become the spongy urethra. So from here to here, this is the prostatic urethra is there, okay, it is the prostatic urethra. And on either side of this utricle, there will be the opening of the right and left ejaculatory duct in the prostatic part of the urethra. So this completes the viva onto the urinary bladder, okay, on the urinary bladder. Thank you very much for watching this short video. Thank you.